Dr. Webb, I'm no good at math, but even I know in a four-way race, it's kind of hard to win 2/3 of the vote. You obviously have to appeal to yet a larger group of voters in the general election, but you only have to win 51%. And you're going to have to appeal, apparently, to Republican voters in that district. How do you intend to run that campaign from here to Election Day?
I think it's one of those realities. You can't choose your moments in politics, and we're in a really unique moment right now. I think the crisis in healthcare, the crisis of racial injustice all over our country, and I think that, I'm a physician, I'm a healer by background, and focused my entire career on being at the intersection of healthcare and social justice. So I think the timing is right, the messaging is right, and it's just a matter of connecting with people who are here in the part of Virginia where I grew up.
How much of the campaign has been has your campaign been about dealing with the coronavirus pandemic?
It's been significant. Of course, every campaign had to change our strategy when the pandemic really struck. And for me, I'm still practicing clinically, I take care of COVID patients in the hospital here at the University of Virginia. And so I'm continuing to see patients in the hospital. I'm working in the community to lead community testing events and also get services to folks. And so there's that dynamic because, like I said, I'm a healer first. And then on top of that, we're running a campaign virtually. And so that's been a huge impact. But I think that for a lot of voters, seeing that commitment to being there in that moment, not to riff off of my commercial, but being there in that moment and making sure that I can to step up to serve my community, I think it mattered. And I think that's a big part of the resounding vote that we've gotten.
What is your number one argument against your Republican opponent going forward in this campaign?
Well, to be quite honest, I don't spend all of my time arguing against him. My number one argument for my candidacy is that we're in a critical moment to fix our healthcare system. And to be honest, I haven't heard much in terms of nuance to my opponent's plans, but I know that from my perspective, there's a critical need to fix our healthcare system. Everybody needs access to care, every single person in this country, and we need to make that happen. We need to deliver on that urgently, and so that's the argument that we're making. It's something that resonates with every single voter, Democrat, Independent, and even Republican, and I think that's something that we're leaning into and making sure we're delivering, especially in the setting of this pandemic.
Do you support Medicare for all, or do you support the Joe Biden approach to healthcare reform?
I'm not beholden to either. I'll tell you, I think Medicare for all may be the most equitable and just form of health in a country. It's more about the path to something along those lines. And to me, I'm focused on what are our next steps. I think a public health insurance option to urgently cover, the 30 million plus Americans who are uninsured, that's got to be our next step. I think we've got to have some meaningful reform to break the bond between employment and health insurance, to change private insurance to something that's more a nonprofit endeavor, to be honest, and change our payment structure. But I think the path is very likely leading to something that does look like a Medicare for all system. It's a matter of folks ultimately voting with their feet, though. And our next step is getting everybody covered.